So let's do a quick breakdown of this report. Okay, so the first thing you want to look at, again, this might be a little bit over the top. It's totally fine. I'm happy to go back to it. We can talk more about it in the membership. But bacterial load is one of the things here that you can look for. Low bacterial load is actually super common in SIRS. Most of us will show low bacterial load. And what's confusing about that is that you will usually see low bacterial load. It's like an overall assessment of how much bacteria do you have in this sample. It's very commonly seen in healthy populations. So what makes SIRS patients very unique is precisely that it's not necessarily an infection. It's like, yeah, we have low bacterial load, but we do have this dysbiosis that is very triggering for us as SIRS patients, right? Some people will show medium and high bacterial load, and usually that's much more common with actual infection, rhinosinusitis. So people who have medium and high bacterial load often will have organisms here that are classic infections like Klebsiella pneumonia, like the organism that can cause upper respiratory pneumonia. Those tend to show medium high bacterial load. And if you have a lot of sinus issues, don't be surprised if you see medium or high. But a lot of SIRS patients are on the low end. And if you have medium or high load, regardless of whether you have SIRS problems, let's say you treat SIRS and you graduated, but you still have some sinusitis issues, and you see this and you see medium high bacterial load, that may potentially require or warrant discussing treating the sinuses, not necessarily for SIRS, just to kind of treat infections if they're present. And this can happen, especially if you've graduated from SIRS, but you still have some unresolved symptoms locally, like infectious types of things. So that can happen, and that's not specific to SIRS. Then the other thing we want to look is at this column that says NGS percentage. This is the relative abundance or proportion of all these organisms relative to one another, relative to whatever they sampled. This is the distribution. How abundant is each of these, basically? So this is not like a raw count of each of them. It's like relative to each other, how much piece of this cake is attributed to Cutibacterium acnes, right? And so just know that species below 2% are automatically excluded from the report. So you won't see them. So you may have a bunch of other species, but they don't get included because that can just be cross-contamination from the environment, particles from your skin, from whatever else. And so they exclude those to make sure you're not getting a lot of noise in your results.